deep bite and full mouth reconstruction. We see a number of these patients routinely in the practice because often they require multidisciplinary care. So a full mouth reconstruction could involve dental implants, could involve removable dentures, although that's quite rare, or it could involve dental crown replacements, bridge replacements, new ultra-thin veneers, dental onlays. So it could be a mix of many different things, many different disciplines. And at Bespoke Smile, you'd see a different member of our team for each individual area of their expertise. So you don't see a jack of all trades, you see someone who does a lot of specific dentistry in one specific area, which would deem them to be more expert in that field. Now, with those full mouth reconstructions, often I'm the one in the practice to plan them. And when I see the patients for the planning appointments, the initial consults, often we will discuss with them what it is they want to achieve. And this patient here came in and showed me her smiles. Now, this patient came in because she had a full mouth of existing dentistry. You can see that there are some dark margins around some of her existing crowns. It's a really common complaint. You can see that there's some chipping and edges, and she's unhappy with the overall appearance. If we look from the side, you can see a big difference between the appearance of the back teeth, where they've had some composite bonding, and on the front teeth, which are dental bridges. And if we take it a step further, we can actually see her deep bite. Now, this is super important. When the patient bites together, this is her bite. So we call this a lip trap. Her lower lip is stuck underneath her upper teeth. What does that do? It actually reduces the height of the lower third of the face. Now, if we want our treatment to be anti-aging, and this patient's in her 70s, and we want to reverse time, then giving somebody a little bit more height in the lower third of the face is actually really beneficial for an anti-aging appearance. Not only that, it's far more attractive that the edges of these teeth sit just above the lower lip rather than over the top of it. So we have to think, what is the cause of the deep bite? So I did a little bit more photography, and we can see that her lower jaw has this sort of a wave shape. Now, in dentistry, we call this a depressed curve of Spee. For patients, essentially, it just means your bite is a little bit uneven. In this case, very, very uneven. The lower teeth are much taller in position than the back teeth. And what that's doing is these lower teeth are crashing up into the top teeth. And that's why we have a situation where we've got lots of cracks. The first step with a case like this is function and aesthetics, always. So if I'm thinking about function, I want my patient to be able to bite and chew nice and evenly on both sides across the mouth and chew their food effectively and comfortably without breaking teeth, without causing gum recession, without any discomfort. And the way to firstly achieve that would be to do something about this curve that we have on the lower arch. So my goal here is to try and find a way of leveling this out so that we have a straighter level on the lower arch. So we call this balancing out the lower jaw, or for patients we use those sort of terminology. For dentists we might call it an occlusal plane. And so what that involves is us thinking how we're going to add here and how we're going to reduce here, or are we going to push these teeth down using orthodontics and braces? So we had a chat with the patient and looked at all possible options, and we decided that we will deal with this as a full mouth reconstruction, starting with the lower and then moving to the upper. As always, the next stage for me is to get my patient into a set of temporaries that mimic the final result, and that's what we can see here. Now, I've leveled out the lower arch and moved her into her final restorations. We've got ceramic crown replacements and new ceramic veneers on the teeth. And then I've made some upper handmade temporaries. Totally handmade, totally bespoke. This is our smile sculpting treatment that we're known for. That has transformed how her lower arch is set out. It's a totally straight plane. And that's super important because now we've also given her a little bit of height in the lower jaw. And if we move on to the final upper restorations, which you can see here, we've got a really natural, beautiful result. And what I love the most is how by leveling the lower jaw, we've created some space between the edge of the lower lip and the edges of the upper teeth. That is much, much more beautiful than the upper teeth going over the top of the lower lip. If I take the lips out of the way and show you the result biting, you can see that everything is much straighter and much more level. And if I ask the patient to open slightly, you can see again that we've got a really level lower jaw, and that is matching with the upper as well. The other interesting thing in this case is that we replaced these teeth with dental implants here. But what you notice is the gum tissue looks just the same as it does on this side, where her natural teeth are. And that's incredibly difficult to achieve. But through working with our team of surgeons and gum specialists, and me as a restorative dentist making the teeth, we're able to mimic nature by performing the right procedures like soft tissue grafts, bone grafts, which is where we kind of rebuild lost tissue, and then shaping that tissue using the shapes of the teeth to truly mimic nature. And I love this result because it's made such a huge difference to this patient's life, but also it's just a perfect example of how multidisciplinary treatment with a focus on aesthetics and function, following all the steps, will produce something as natural and as beautiful and long-lasting as this.